And welcome back to Yahoo Finance on the Move. As we take a look at markets, the NASDAQ up over 70 points. Dow is up over 20 points. S&P 500 still positive, up above 10 points. But a lot of this is dependent upon progress in the fight against coronavirus and COVID-19. Dr. Shira Doron is Tufts Medical Center epidemiologist and joins us now to discuss some of the news we heard yesterday from Anthony Fauci predicting the potential for 100,000 cases a day, but also the potential for a vaccine. Good to have you here, Doctor.
Good to be here.
Where do you want to begin? I mean, a lot of us were taken back when Dr. Fauci made that prediction. Should we be afraid of what he shared with us, or is there a way to get ahead of what he said?
Well, we do need to take this very seriously. You know that growth of viral cases is exponential. And the more out of control it gets, the more out of control it gets. And so every individual really needs to be doing their part right now.
When you think about the overall picture in the United States, of course, it goes without saying, it's pretty bleak, right? In 45 states, I think the 7-day averages of new infections are actually higher than they were a week ago. So any sort of glimmer of hope or promise of improvement has quickly faded. What is your message to some of the Americans out there who have really politicized things like wearing a mask or, those safety precautions that originally were perhaps better upheld?
Well, I think that they really need to be looking at the states and regions that have had success. If you look at New York, New Jersey, Connecticut, Rhode Island, Massachusetts, the entire Northeast, really, there's a lot of success here in this area. The transmission rates are low. Massachusetts reported 0 deaths yesterday for the first time since March. And so there are a lot of lessons to be learned about the importance of distancing and facial covering wearing as part of the control of the spread of this virus.
When you think about the hospital capacity as well, it's so interesting. I'm here in LA. The UCLA system teamed up with 5 different nonprofit health systems here to kind of send a message out to patients being like, you need to still treat your other conditions, right? Coronavirus, yes, is a big deal, but I think there was a lot of fear mongering earlier on, especially with relatively healthier folks who were dissuaded from going to the hospital and quote unquote taking up a bed. What's your pulse at Tufts and also in the greater Boston area right now in terms of capacity?
Well, I mean, each area is going to be different in terms of their capacity. And right now, because here in Massachusetts, we're at the tail end of a surge, we are encouraging anybody to come in and get their underlying conditions treated. Now, when a hospital is in a surge such that bed capacity is limited, then they do have to start advising people and actually canceling or postponing procedures that might otherwise have been felt to be necessary. So it's really a day-to-day consideration in conjunction with your provider.
Doctor, we heard recently from the FDA that they will only approve a vaccine that has 50% efficacy going forward. Help us with the context of what that means. Whether, for instance, what's the efficacy, and I realize it changes year to year with the flu vaccine, but what does that mean, 50% efficacy?
Yeah, I mean, that's a tough bar. And as you said, with the flu, some years the efficacy is 40%, and some years it's even worse. Now, part of that is because the flu virus mutates every year, and the coronaviruses don't mutate that quickly. So we hope that the vaccine candidates will be better, but it is entirely possible that early candidates will not reach that 50% mark.
Shira, it's Brian Chung here. So we were talking earlier about capacity for the hospitals, but what's been interesting to me is also the capacity to test. So as we've seen other states like Arizona and Florida really ramp up in the amount of cases, there's an interesting thread here about whether or not we might run out of tests. That's the kind of the basis for this Atlantic article that came out yesterday. Is that something that you've seen as a concern in your area? Is there a worry that if we can't get this contained, we actually also won't be able to track it?
Yeah, so our area right now has testing capacity beyond the current demand. But as is the case with, every step of this pandemic and it being global and happening all over at the same time, the supply chain is just such a critical issue and an ongoing issue. We run out of things like the swabs themselves. We run out of the viral transport medium and the testing kits that go in the machines. So, and we are hearing that that is happening in areas that are being hardest hit right now. So that is a serious concern.
We know there's been a lot of interstate comparisons in terms of how governors and mayors have been handling this crisis and the response, but there's also a lot of cross-cultural and international kind of debate. Are you in touch with any colleagues overseas? Have you heard any sort of anecdotes or feedback from folks abroad who perhaps are analyzing the US's response and comparing it perhaps, in almost a dismal light?
I haven't really had conversations about that. I mean, I think, it's pretty obvious that the situation here is bleak and dismal, and that there needs to be a more coordinated effort to improve our collective response. I certainly connect with colleagues in other countries around issues of treatment and management and, curiosity about how they're doing things differently, which certainly always is useful to inform our practice here.
Dr. Shira Doron is an epidemiologist at Tufts Medical Center. Thank you so much for joining us on The Move.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.